Hospitals and healthcare organizations face an unprecedented level of cyber threat. Unlike other sectors, the stakes in healthcare cybersecurity extend beyond financial loss or reputational damage. A successful cyber attack can directly jeopardize patient safety and even lives. Understanding this unique threat landscape is the first step toward building robust defenses. The sensitive nature of patient data makes it an incredibly valuable target for malicious actors. This includes protected health information, personally identifiable information, and financial details. Such comprehensive data sets are highly sought after on the dark web for identity theft, medical fraud, and extortion. Healthcare environments are inherently complex, contributing significantly to their vulnerability. They often operate with a vast array of interconnected systems, from electronic health records to diagnostic equipment and medical IoT devices. This creates an expansive attack surface that is difficult to secure comprehensively. Many healthcare organizations also rely on legacy systems that are challenging to update or replace. These older systems may have known vulnerabilities that cannot be easily patched, leaving critical entry points for attackers. Budget constraints often prioritize patient care over IT infrastructure upgrades, exacerbating this issue. The sheer volume of data processed daily, combined with the urgent, high-pressure nature of healthcare operations, can lead to security oversights. Staff may inadvertently click on malicious links or bypass security protocols in an effort to expedite patient care. This human element is frequently exploited by cybercriminals. Furthermore, the supply chain in healthcare is extensive, involving numerous third-party vendors and service providers. Each vendor represents a potential weak link, as a breach in one partner's system can cascade and compromise the entire network. Managing this third-party risk is a continuous challenge. The consequences of a cyber attack on a healthcare system are far-reaching and severe. Ransomware, in particular, has become a pervasive threat, encrypting critical systems and demanding payment for their release. This can bring hospital operations to a standstill, forcing staff to revert to paper records and manual processes. Operational disruption directly impacts patient care. Surgeries may be delayed or cancelled, emergency services diverted, and access to vital patient histories blocked. This can lead to delayed diagnoses, improper treatments, and, in extreme cases, preventable deaths. The financial cost of these attacks is also immense, encompassing ransom payments, recovery efforts, and regulatory fines. Data breaches, even without ransomware, carry significant repercussions. Stolen patient data can be used for identity theft, leading to fraudulent medical claims or financial ruin for individuals. For the organization, a breach erodes patient trust, damages reputation, and can result in costly litigation and compliance penalties, such as those under HIPAA or GDPR. Beyond the immediate chaos, a successful cyber attack can have long-term effects on a healthcare organization's stability and ability to deliver care. The recovery process is often lengthy and expensive, diverting resources from essential services. The psychological toll on staff, dealing with the aftermath and potential patient harm, is also considerable. The healthcare sector has been a frequent target for high-profile cyber attacks, providing stark lessons. We have seen numerous instances where ransomware has crippled hospital networks, forcing them to turn away ambulances and reschedule thousands of appointments. These attacks highlight the immediate and tangible impact on patient access to care. In some cases, attackers have specifically targeted medical devices, demonstrating the potential for direct harm. While not always successful in causing physical damage, the threat of manipulating insulin pumps or pacemakers underscores the critical need for device-level security. The interconnectedness of these devices with hospital networks creates a complex security challenge. Data exfiltration incidents have also been prevalent, where millions of patient records are stolen and sold on underground forums. These breaches often stem from sophisticated phishing campaigns or unpatched vulnerabilities in external-facing systems. The long-term consequences for affected individuals, including identity theft and medical fraud, can be devastating. Supply chain attacks have also impacted healthcare, where a vulnerability in a third-party software vendor or service provider leads to a widespread compromise across multiple healthcare organizations. This emphasizes the need for rigorous vendor risk management and continuous monitoring of third-party access. Each incident reinforces the reality that no organization is immune and proactive defense is paramount. Protecting healthcare data requires a multi-layered, comprehensive approach. Technical controls form the backbone of this defense. Implementing robust access controls, including multi-factor authentication for all systems, is fundamental. The principle of least privilege should be strictly enforced, ensuring users only have access to the data and systems necessary for their role. Network segmentation is crucial to contain potential breaches. By dividing the network into smaller, isolated segments, an attacker who gains access to one area cannot easily move laterally to compromise the entire infrastructure. Regular patching and vulnerability management are non-negotiable to close known security gaps before they can be exploited. Data encryption, both at rest and in transit, provides a critical layer of protection for sensitive patient information. Even if data is exfiltrated, encryption can render it unreadable to unauthorized parties. Comprehensive backup and recovery strategies are also vital, ensuring that operations can be restored quickly in the event of a ransomware attack or data loss. Beyond technical measures, strong governance and policy frameworks are essential. This includes developing and enforcing clear security policies, ensuring compliance with regulations like HIPAA, and establishing a robust incident response plan. This plan must be regularly tested through drills and simulations to ensure the organization can respond effectively to a real-world attack. While technology provides powerful tools, the human element remains both the greatest vulnerability and the strongest defense. A significant percentage of cyberattacks originate from human error or social engineering tactics. Therefore, cultivating a strong, security-aware culture among all staff members is paramount. Regular and engaging cybersecurity training is not merely a compliance checkbox, it is a vital investment. Training should cover common threats like phishing, ransomware, and social engineering, teaching staff how to identify and report suspicious activities. Emphasize the real-world impact of these threats on patient care and data privacy. Staff must understand the importance of strong, unique passwords and the proper handling of sensitive information. They should be trained on secure browsing habits and the risks associated with opening unsolicited attachments or clicking unknown links. Encourage a culture where reporting potential security incidents is seen as a positive contribution, not a cause for blame. Every individual, from clinicians to administrative staff and IT personnel, plays a critical role in the organization's security posture. By empowering staff with knowledge and fostering a security-first mindset, healthcare organizations can significantly reduce their attack surface. A vigilant and well-informed workforce is the most effective frontline defense against evolving cyber threats. Protecting patient data is not just an IT responsibility. It is a collective imperative that safeguards lives and maintains trust in the healthcare system.